We are going to talk today about Excellident and my experience with it. It's been the greatest new advantage in my practice in the past year, and I'm excited to share with you why I use it and how I use it, and give you some tips and tricks for using it within your practice. I am not an expert, but I hope that by sharing my personal experience, you can gain some ways to better improve efficiencies in your office, to accelerate treatment, and to improve the patient experience. After all, that's what we're all after. So we're going to talk about treatment planning techniques. I know many of you have used Excellident before, so I'm going to cover the basics for those who are not familiar, but I'm also going to go into some detail about how we use it, and I'll show you some of my clinical finishes so you can get a good idea of what you can expect to happen when you use it. We're going to start off with the basics, some science, a little bit about how it works, and then we'll dive into the cases. And at the end, I'm going to try to leave plenty of time for questions. I've spoken to doctors before. There tend to be some common ones that come up. I will try my best to cover those as we go through, but I will try to get to as many questions as I can when we get to the end. A little bit about me. I am a mom of 3. I have a 4, a 6, and an 8-year-old. They keep me very busy. And I am married to an oral and maxillofacial surgeon. I work at Impact Orthodontics in Calgary, and I did my dental school at the University of Alberta in Edmonton. I graduated in 2004. I went to the University of Michigan and did my orthodontic residency there, and I graduated in 2009. Go Blue. At my practice right now, I use twin brackets, self-ligating brackets. I'm in a GAC Innovation MBT prescription, and I also do a lot of Invisalign. I heard about Excellident early in 2014, and after doing a little bit of research, I found myself a guinea pig in my mother, and we'll get to her case in a little bit, and I started using Excellident on patients in the fall of 2014. I have since fully integrated Excellident into my practice, and by fully integrated, I mean that since January of this year, I have given an Excellident unit to every single patient that is in comprehensive care. That means fixed and Invisalign. There is no option here. Every single patient gets one. And I'm not suggesting that's the only way to do it, but that is how I have chosen to integrate Excellident, and we'll get into the why of that as we move forward. As we all know, there are so many things that impact how long orthodontics takes. We've got complexity of the case, how far teeth are moving, which appliances we happen to be using. Patient compliance is always way up there. And of course, which types of forces we are applying, their hygiene, their elastic wear. I don't know a single patient that thinks orthodontics finished too quickly. Everyone wants it to be faster. I find it starts out fun, and then they want to be done. There has been lots of research on this, and this study out of the University of Connecticut reported that the majority of patients feel treatment just takes too long. And I know for years I've been hearing that same statement. When am I done? When are we finished? How much longer? And in fact, currently, 7 out of 10 patients are not even offered accelerated treatment by their orthodontist. And that's why we're speaking today. There is a very easy way to make treatment faster. And we're going to show you how to do that. When orthodontists were surveyed, it was found in this study that 26% of orthodontists did offer some form of accelerated treatment. That actually seemed pretty high to me. That's not bad. And 62% of those were offering Excellident. I do not offer any of the other items that you see listed there. I have not dabbled in any of that at this point in time. Excellident is the only accelerated treatment option that I have used, so I cannot speak to the others that are there. My favorite thing about Excellident is that it is non-invasive. I don't have to convince anybody that this is something that they need to do and that it might be uncomfortable, because it's not. It's easy. And patients are always more willing to do something that is non-invasive. they're also willing to pay for it. And we'll talk about that a little bit as well. If we can make it more comfortable and faster, they're going to want in. Now, we have patients ask us quite often, is this new? Is it safe? Has it been tried somewhere else before? And I find myself or my treatment coordinator explaining often to people that this has been around since the 80s and has been used in healing long bone fractures and treating osteoporosis since that time. And Excelident is simply an application that is now inside the mouth and geared towards faster tooth movement. That picture you see on the bottom right corner there, I think someone told me that's called the granny shaker. Anyway, that's for treating osteoporosis, but it's the same idea. By using vibration to stimulate the bone, we are increasing cellular activity, so remodeling of bone. And that is what is being applied to the mouth and to the teeth. I have not read every one of these studies. This is a sampling of a lot of the literature that is around, studies done both on people and on animal models about the effectiveness and safety of using vibration to stimulate resorption of bone and remodeling of bone to increase movement. So feel free to look into any of these or talk to your local rep. They can give you all sorts of studies you can look at if you really want to get and dig into the science behind all of this. This is what the Excelident looks like. It's a cute little device. It's very light. It is in two basic pieces. So this here is the mouthpiece, and it pulls apart from the base unit here. And you can see in the case it can be stored, put together, but they come apart because you can't put the base unit in water. So the mouthpiece, if the patient wishes to rinse it or brush it, they remove it from the unit to keep it clean. It also comes with a wall charger that looks very much like a cell phone charger, and a USB cable, which can be used to put the data into your computer. That is not a feature we talk about a lot in my office, but I think in some applications it's useful to be able to see how much the unit is being used. It provides 25 grams of force at 30 hertz. We give one of these to each patient, and they use it for 20 minutes each day. We recommend that they use it for 20 minutes at one go. The unit will give them notice when it's halfway through, 10 minutes, and then it shuts off automatically at the 20-minute point. I found it quite helpful to suggest to people when might be a good time to do this. My office manager, my receptionist, who both have used Excelident, used their units while driving to and from work because they had a lengthy commute. My sister told me she often used it while washing the dishes. It is hands-free, so it's in the mouth. It has to have 3 to 4 points of contact with teeth, and it does its thing. So sitting at a computer, reading a book, doing homework, watching TV, any of these are great times to use that Excelident. And I'll get into compliance, but we have had great success with our patients routinely using their Excelident because we talk about when they should be using it. Here's the quick and dirty. So it's fast. It's safe, accelerates tooth movement up to 50% faster. It's just 20 minutes a day. It's been cleared by the FDA and by Health Canada, and it's gentle. I've never had a patient tell me that this was an uncomfortable experience or that it was painful in any way. Sometimes I get it feels kind of funny, but that's usually it. And most of my patients feel that their teeth feel so much better after using it that they look forward to using their Excelident each day, especially in those fixed patients where we've just changed a wire or done something new, added power chain, and they know there's going to be some increased pressure in there. They look forward to using their Excelident unit. Let's go to my guinea pig. So I needed to find someone that I could try the Excelident on that wouldn't be mad at me if it didn't work. At least that was my thinking. And my mom came to mind. She was complaining about her lower incisors often, and I kept saying, just let me fix it, Mom, just let me fix it. And she kept saying, no, I don't want braces and I don't want anything that'll take too long. And so I said, hey, I've got a new gadget. I think I can do it really fast. Please let me do this. My mom was 55 years old at the time. She had never had orthodontics. We had some lower anterior crowding. She wanted to do this quickly, so I jumped right in with her switching her aligners every 5 days. And we finished her up in 3 months total treatment time with no refinement. I wanted to do a refinement. She refused. It turned out pretty good. So here she is. She, of course, one of those adults who had the common story of my teeth used to be perfectly straight and now they aren't. And so, I mean, Invisalign is an awesome choice here. We didn't do any IPR. I did a little bit of expansion up top, so I get myself a little bit of room and got her lined up. And I think for the most part, she felt it was really comfortable. I was most curious about what the 5-day aligner switch was going to mean. And to be honest, she said by day 5, the aligners always felt really loose, so it was never an issue to switch. My traditional, what I call traditional Invisalign protocol was to switch every 2 weeks. And in my teenagers, we were switching every 10 days. And then with Excelident now, most of my patients are on a 5 to 7 day switch sort of cycle. And I'll explain in a few moments here how we decide how often they should be switching their aligners. So here she is at the end. I apologize, I have no facial photos, but she hates getting her picture taken and I didn't push the issue when it came time to take those photos. So we didn't do any elastics. We weren't working on midline. She had no desire to go there with that. But with no refinement and switching every 5 days, I was really happy, and so was she, with where everything ended up. 3 months in the grand scheme of things really is fast. And it felt like it sort of flew by, and I think she felt the same way. Now, how did we integrate this? I spoke a little bit already about how I started dabbling, and then in January of this year, we went to everyone getting one. So when we decided to jump in the fall of 2014, we just started offering Excelident to everyone, and we offered it at a fee. So at that point, it was the cost of the unit to me. Now, it depends on how many you purchase, on how much that is, but we decided on the number of $750 Canadian, and that was what it was offered at. That was offered at every new patient exam, and it was offered to anyone in the chair that we thought would benefit. So that included new patients, patients in treatment, patients where we were doing space closure and it was taking its sweet time, adult relapse cases who just really didn't want to be back in treatment again, anyone concerned with hygiene, and anyone who was trying to get done by a certain timeline. So often graduation or a wedding or a party or whatever it was, if there was a way we could make it faster, we offered it. And I would say we did okay on that. 100% of people that we offered, of course, did not take us up on that offer, but we had a good handful of people that thought that it was a great idea, and they went ahead and started with Excelident. There were some things I noticed right away, and I definitely had more patients using Invisalign that were using Excelident than I did in full fixed when we first started. And part of that was I knew right away that I could tell my Invisalign patients that if they bought an Excelident unit, they could go from switching those aligners every 14 days to switching them every 7 days, or from 10 days to 5 days. And of course they can do the math, and that means that we finish twice as fast as we were going to finish without it. So we found acceptance from Invisalign patients was high very, very quickly. I also found right away that teeth were tracking much, much better. Patients had no problem switching every 5 to 7 days. They were telling me they were so loose they were falling out at the end of that term. And everyone said they felt great. So teeth felt better, especially those who started without it, got the Excelident partway through. They reported comfort more than anyone else because they knew what it felt like to not have a unit and what it felt like to have a unit. And so it was great to have a handful of those, because people who had never had teeth moved before wouldn't necessarily know what that would feel like without an Excellident. And at that point, probably by December of 2014, I decided that I really, really wanted everyone in Invisalign to have an Excellident, because I was getting frustrated with those who weren't using an Excellident with things not going exactly as I wanted them to. I seemed to be having less trouble in general with those that were in an Excellident. I'm going to show you a few of my Invisalign cases here. This is Lindsay. She is a 31-year-old female, and she came in simply worried about crowding. As you can see, we've got a narrow maxillary arch, we've got an anterior open bite, and we're class 3 and we're crowded. She was also getting married, and so we were in a rush. So she was one of my early takers on an Excellident unit, and she was in treatment for 10 months total time. Her initial ClinCheck came back with 35 aligners. She was switching once a week. I tried to get her to switch every 5 days, but she liked switching on the same day of the week every week, so my arguments were futile there. So she liked Fridays as her switch day, and we stuck with Fridays as her switch day. She wore class 3 elastics for me. We did not do any IPR. I don't do a lot of IPR, so you'll see that as a theme here. Her refinement was 8 aligners. We just had 1 refinement, and she was a very motivated, very compliant patient. This was where we ended up. This was one of those cases when I looked back at the photos, I went, wow, well, that turned out better than I thought it was going to. Lindsay did a great job, and this is one of my, I think, good examples of what compliance combined with some good planning will do for you. I find I struggle with adults in the class 3 sometimes, and this one went incredibly well, and Lindsay was thrilled, and she was one of those people who said nothing ever hurt. It always felt fantastic. This is Emily. She is 17 years old. Now, I know a lot of you that are listening probably do a fair share of Invisalign. I've been doing Invisalign since 2004 when I was a general dentist before I went back to do my orthodontic residency. And deep bites are something that I really, really struggled with. Not as much in teenagers, but still always a difficult correction. So there were a few things I did here. Invisalign's gotten much better at tools for deep bites. We've got some collapsed arches here, some crowding, a severe deep bite, retroclined incisors. So when I went in to do the Invisalign plan, I do a lot of overcorrection in my deep bites, so the ClinCheck would have looked like she finished in an anterior open bite. I used the bite ramps that they now provide on the palatal aspect of upper 2 to 2. And I was fairly aggressive in my expansion here. Emily had 50 aligners. We did a 5-day switch throughout the entire treatment. She just used her smartphone and put an alert in, which we have a lot of our patients do. It's an easy way for them to be notified when that 5 days is up so that they can switch their aligners. She didn't have any IPR. We didn't use any elastics. And we didn't do any refinement at all. She was thrilled when we were done. It only took 9 months altogether, and we were finished. And I can honestly say refinements have been the norm for quite some time in my office, at least one of them, sometimes two. And I've had a solid handful of cases in the last while here when using Excellident where we don't do a refinement. And everyone's excited when we get through that first set and we're done. I always prep them for more than one set. We call that first batch of aligners they receive their initial set of aligners. And I always explain to them that it's not going to be the only set. I find if I prep them for at least one refinement, I don't get any battle back on it. And oftentimes, if they count up the number of aligners and the number of days, and I've estimated it will take a year, and they're saying, well, that looks like it might only take 6 months or 7 months or 8 months, I explain that there's always a chance, but most likely we get through that first set, there's some tweaking that's going to have to happen. Here's Emily at the end. So this was 9 months out. She did great. She really was compliant. She was very motivated. And that deep bite correction is probably one of the better ones that I've had. I'm by no means perfect, and I'm always working at doing things better. But this was one that really impressed me, and she was fantastic with the whole thing. Again, another patient who said it never hurt. Nothing ever hurt. And she sent me a few of her friends since then because they wanted something that didn't hurt to get those teeth fixed up. Here's Jennifer. I have found that with Invisalign, lateral incisors and rotated canines can sometimes be the bane of my existence. And when I'm doing refinements, it's almost always one of those two things that just never quite gets there the first time. I think I'm getting better at my ClinChecks these days, so I'm hoping refining based on that will be less and less. But Jennifer here is an example of where that happened. She's 19 years old. She was in treatment for a total of 6 months. I think it would have been a little faster. However, she was away at school. So she was in Victoria and I'm in Calgary. So I didn't get to see her quite as often as I normally see my patients. So upper left lateral was the one I was most concerned about with that rotation, some crowding on the lower. She had 25 aligners initially. We did do a little bit of IPR, lower 2 to 2. And then she was switching every 5 days as well. We did have to do one refinement. It was for that lateral incisor. It was 5 aligners. I just don't think I did enough overcorrection in the ClinCheck. So we weren't quite there when we got through the first 25. But she looked great when she was done. It's really nice to be able to give someone their treatment and say, yeah, it's okay if you live, an hour flight away or a 12-hour drive away. I only need to see you once or twice in this whole course of treatment. She really enjoyed the process. And I'm happy with that lateral incisor. I got it to where it needed to be. Now, fixed cases, I struggled with a little bit. It was harder to put an exact timeline benefit on it for patients. Like I said before, with Invisalign, it's easy to say, well, we use Excelodent, you switch every 5 to 7 days. We don't, you switch every 10 to 14. So it was very easy to put a time frame on it, and I could illustrate the benefits very, very quickly. So when I started doing Excelodent for everyone, including my fixed cases in January of this year, I was curious to see what I would find and also what patients would report. And actually, initially, what I heard over and over and over again was that people's teeth felt good. Again, this was most noticeable in people who got an Excelodent after they had started. But we often ask people when they come for their regular adjustment appointment, how are your teeth feeling? Has anything been sore? Etc. And most people were just saying, oh no, my teeth feel great. I can eat whatever I want. What I noticed, and I'm in an 018 slot, is that I started to skip wires a little bit. If I had started in an 014 NiTi and they were coming back 8 weeks later for their first adjust, I was jumping over my square NiTi, which I often go from a round to a square to a rectangular NiTi as my first 3 wires. And I found that I was skipping the square NiTi because things were leveling and derotating a little bit faster than I expected them to. And so it allowed me to get up into my working wires quite a bit faster. Another thing that started happening, which freaked me out just a little bit, but I was really excited about, was that we started getting these crazy overcorrections with good elastic compliance. I didn't expect that. I'm not sure why I didn't expect that. It makes sense, but we would have some of my compliant, mostly female teenagers, I'll say, leave with full-time class 2 elastic wear and come back end to end in one interval. So 8 weeks or so between appointments. And so I was dropping people off of full-time elastics all over the place. That also happened in my Invisalign. I don't think I mentioned that. My Invisalign patients and elastics, same thing was happening. We were getting crazy overcorrections. I actually had one teenage girl who we were doing a 2mm midline correction. And our Invisalign patients are seen every 12 weeks or so. And in 12 weeks, she overcorrected 2 mm beyond where I needed her to be, which is like a 4mm midline correction in 12 weeks. And I had to take her aligners, cut new notches, and switch all the elastics back around the other way and had her wear it just 12 hours a day to try to get her to center where I actually needed her to be. So the thing that I love about that is that patients don't like wearing elastics. It's always a compliance issue. So if they're going to have elastics for less time, we're more likely to get to where we need to go with the elastics. As far as finishing faster, I would say for sure we finish faster. I have yet to define exactly how much faster. It's months for sure. I would say on average, I'm going to say about 6 months in my office. My average treatment time is about 22 months before Excelodent, but we're still gathering some data on that since I really only have fixed cases with Excelodent since January of this year. So here is a fixed case. This is Tuscany. She is 13 years old. She was in treatment for 11 months total. We've got that crossbite on that upper left, 3 really narrow arch forms. Midlines are off a little bit, and I'm pointing that out because it doesn't get completely fixed. This girl absolutely refused to wear elastics. I always have a good handful of those, but I only have a handful of fixed cases finished that I can show you because it hasn't been very long that I've been using Excelodent with my fixed cases. So like I said before, I'm in an 018 slot. Tuscany was done in a GAC Innovation bracket, and we went from an 014 NiTi to a 16 square NiTi to a 1622 NiTi to a TMA. I didn't skip any wires in her case because she was one of the first ones that I was doing with Excelodent, and so she was on our normal 6 to 8 week appointment interval, and she would not wear elastics for me. So we agreed to disagree on the elastics, so we ended up with midline still off a little bit when we finished up, but she was happy. She couldn't believe that she was done in less than a year. Most of her friends had had braces for 2 years or longer. She just thought it was fantastic. And again, reported comfort throughout. So she really felt that everything felt really good. She had no issues with eating. She was just very positive and happy about the whole experience. I'm going to show you Karen next. Karen is 14 years old. I get nervous, I don't know about you, when I see a class 3 bite in someone who I know is growing rapidly. Karen was probably in the middle of her growth spurt when we saw her. Being a girl, I was a little bit less worried than if it would have been a male of the same age. But this is an example of where the elastics were awesome. So Karen would wear elastics for me and didn't wear them for very long at all. I'm going to say that that is due to the Excelodent. She was in an 018 slot. However, she was in a twin bracket. She was a colorful girl. And we only used 3 arch wires here. So we went from an 016 to a 1622 NiTi to a 1622 TMA upper and lower. She saw me every 6 weeks, and that is typically our current routine. And she was fantastic with her elastics. When we first got into our TMA wires, I put her on full-time class 3 elastics, and she came back with excessive overjet. So we backed off of those very quickly. And she was in treatment for 9 short months. And this was where we ended up. Again, great patient, very compliant, did a fantastic job. And those elastics, I mean, did what they had to do. It freaked me out just a little bit to see the overjet when she came back in, because I don't see that a ton. But it was rather exciting to be able to say, okay, you wore full-time elastics for 6 weeks, now you're done. Let's stop those for a little while. I stopped at that overjet, came back fairly quickly, and then we had her just on bedtime elastics right till the very end. So there are a few protocols that we've implemented in the office. Like I said before, with Invisalign patients, every single patient in Invisalign receives an Excelodent. The reason this is not an option is because I don't want it to be an option. My Invisalign works out so much better and so much faster with an Excelodent that I find it too frustrating at this point to do it without using an Excelodent. So it is explained at the beginning that this is part of treatment, that this is a piece of technology that I think is important and that they need to use it for us to get the best possible results. Now, what we're doing at the moment is anyone under the age of 25 will automatically be on a 5-day switch with their aligners. Anyone over 25 will begin by switching every 7 days, so once a week, until that very first adjust appointment when they come back to see me. And then there's a series of questions I will ask them to determine if we can go down to 5-day switches. And I would say a lot of the time we can. What I generally ask is, do they find that at a certain point in that week with each aligner, do they feel that the aligners are excessively loose, or that all pressure is gone, or that they feel they could switch sooner than the 7 days? Almost everyone says they think they can. For those that state that the aligner still feels very tight at the end of the 7 days, or snug, or not loose, or they think the 7 days is perfect, I usually have them stay on the 7-day switch. But for anyone who feels that that aligner is loose, I ask them to switch to 5 days. At this point, having been in aligners for 12 weeks, I let them know. If they try to switch at 5 days and it just doesn't feel right, then go back to 7. But the majority of my patients switch their aligners every 5 days, and we have no issue with that. Patients are seen every 12 weeks, and my patients are given all of their aligners at their insert appointment. I do place all attachments at appointment number 1. I generally do any IPR that I need to at aligner number 1. However, my protocol for IPR is generally to do it before a refinement, not in the initial set of aligners, so that doesn't happen often in the office. There are several reasons for that. Number 1, I don't want to store everyone's aligners. I have a small office. I don't have a ton of storage. We do a lot of Invisalign. I don't have space to keep everyone's cases. And second, it's mostly for patient convenience. People have to reschedule appointments. Life gets in the way. And if they're switching their aligners every 5 to 7 days and they have to move their appointment by 1 or 2 or 3 weeks, I want them to be able to continue on in treatment and not have to pause because they have to come back to see me to get more aligners. So we've decided that giving them all of their aligners at the outset is going to be the easiest way for us to continue on. When they come for a regular appointment, I simply ask them to bring whatever aligner they're currently wearing with them, which is what they should be doing anyway, because if they don't have it with them, they're obviously not wearing them. And that works really, really well for us. There are a huge number of advantages here. Comfort is always at the top of the list for me. I like it better when my patients are comfortable. My patients like it better when they are comfortable. And that is probably the number one reason that I use it. Things track better in Invisalign. That's huge for me as well. And I find I'm doing far fewer refinements and mid-course corrections at this point, which makes everyone happy. So technically, I don't think every case finishes 50% faster, but there are definitely a solid number that do, and many that are very close to that number. I find that most of my difficult movements are happening more reliably. That's important to me. In Invisalign, when we're doing severe rotations, deep bite corrections, class 2 correction, extraction cases, the Excelodent helps all of those things to happen as safely and quickly as is biologically possible by using the Excelodent. And that is how I explain it to my patients. We talk about biology and we talk about safety and comfort. And those things all together make it worthwhile to me for every single individual to get an Excelodent unit. Now, of course, that means it's built into my fees. We do not separate out records in my office. We do not separate out Excelodent. And my fees for Invisalign or Full Fixed are the same. That's just practice management the way that I want to do it, and I'm not suggesting anyone else has to do it that way, but that's what works well for me. And in 2015, so from January to December of this year, I did not increase my fees from 2014. That freaked my office manager out just a little bit, but I wanted to see if it would hurt the bottom line to be using a piece of technology that is relatively expensive, but finishes treatment faster, thereby allowing me to see more patients, pump more people through the system, et cetera, et cetera. And I can honestly say it worked very well. We're busier than we were at the beginning of the year. Everyone's finishing faster, everyone's happier, and my bottom line is doing just fine. In Fixed, everyone gets an Excelodent, same as Invisalign. And I see patients every 6 weeks. Now, we've played with a few intervals here, and I've spoken to some doctors who use Excelodent who will see their patients every 4 weeks when they're using Excelodent because everything's happening a little bit faster. We have found that difficult to do consistently in the office. The 6-week interval works really well for us. It also works really well for our patients. I find there's a little bit of pushback on coming to see me every single month. And so I like the 6 weeks. I still feel like because I'm skipping some wires, we're cutting significant time off. And I like 6 weeks better than 8 because with the elastics right now, and I'm keeping an eye on things, my really compliant elastic wearers, I don't want them to overcorrect so far that it's difficult to come back for it. So we're working on those protocols, but everyone gets one. Patient comfort is still number one here, and I think with Fixed, that's the thing you'll notice very first. For me in a 018 slot and anyone else in a 018, initial level in Align can sometimes be the hardest thing that we have to accomplish, and the Excelodent is absolutely making that faster for me. Space closure is also faster, severe rotations, and of course all that elastic wear seems to be rocking with the Excelodent in there. So I know we're cutting time off. I unfortunately can't give an exact number at this point, and we are for sure using elastics for less time, which makes the patients happy. And I should have more data on this soon. I now have a solid handful of patients, canine exposures using Excelodent and a bunch of surgical patients using Excelodent. And hopefully when those cases finish up, I can show some of those happening more quickly by using this technology. When we first started giving Excelodents to every single individual, we realized quite quickly that a lot of them weren't using it at all. That's a problem. And so we had to sit down as a team and figure out how are we going to get them to use this thing? And it wasn't the Invisalign patients as much as the Fixed patients. And so we now make it protocol that the very first thing we ask every single person about when they sit down is how much do they use their Excelodent? And if they're not using it every single day, why not? And we document, and we document. And oftentimes out of my mouth comes a sentence similar to, well, if you're not going to use it, please bring it back to me. It's expensive. No one's ever brought one back. But we talk a lot about how by not using Excelodent, they're going to make this take longer and hurt more. We know that for sure. We reassure them that they made the right choice and that by using it, things are going to be as good as they can be. I only have a handful of patients who don't use Excelodent. those cases that started without it, there are still a number of people who chose not to use an Accellident. But I will continue to use it going forward on every single patient that comes into my office. I have yet to see a disadvantage. And that's the end of that. I'm going to get to as many questions as I possibly can. We've got about 20 minutes. So we'll see what we've got here. Okay, first question. Would 2 10-minute Accellident sessions hours apart work as well? The short answer to that is yes. I've asked my rep about that specifically, and they can split it up. However, they do recommend that doing all 20 minutes at one go is better. I feel like it's just easier for the patients because then it's just over and done with. Then they're less likely to forget that they have to do the second 10-minute session. But I do have a handful of patients who do it that way, just based on their schedules. But the majority will actually do it all in one go. Okay, when you say you include the device in your case fee, does that mean your fee is higher than your normal case fee? Or because of the decrease in treatment time, are you charging the same as your normal case fee? And as an orthodontist, do you have a range of fees depending on the severity of the case? Okay, I'll try to get to all of these pieces here. When I include the device in my case fee, no, the case fee, at least in 2015, is not higher than my normal case fee because there is no normal case fee. So when fees are presented to patients, it is based on treatment time in my office. So we have a range of fees based on complexity, but the fee includes whatever comprehensive care is, including the Accellident unit. We don't separate it out. The patient is not aware of how much that would specifically cost. And my fees for fixed and Invisalign are the same. So I have no difference there. Let's see, did I miss a part of that? In Calgary, I'll give you an idea here. There's quite the range of fees as far as orthodontics go, and we're fairly high as far as cost of living goes. So my full fixed fee ranges between $7,000 and $8,500, depending on what it is we're doing. I would say my average case fee right now is $7,400, and that was the same as my fees were in 2014. Any problems with perio patients? No, that's funny actually. I was just having this conversation. I do have a handful of perio patients that are in Invisalign that use an Accellident. And I would have to say that based on the research and science that exists, there should be no contraindication to a periodontal patient using an Accellident. We're simply increasing cell turnover, and as long as forces that are being applied to the teeth are within the limits you would use on a periodontal patient, I don't think there would be any problem. I have not seen any personally. I don't see a lot of severe perio patients, so I can't speak to that. But so far, no, there has not been any issue with periodontal patients. Do you connect their devices to your computer at their visit to check compliance? I do not. Unfortunately, we do not have enough time. That would involve plugging it into our computers, which are actually difficult to get to at the chair to check. We do let parents know that if they want to keep track, they are welcome to take their child's unit, if the child is the patient, or themselves if they want to see, and plug it into their computer to see if it's being used, but I do not personally check. I think if it existed, and they might be working on this, I guess I can ask them, in a way that was, let's say, Bluetooth or wireless, where it would automatically talk to our computer, somehow I would check it. But we don't ask our patients to bring their units with them to their adjust appointments, so we don't usually have it with us. Some of you are quite amusing in your questions. I wish you could all see all of them. Have you experienced any serious root resorption with patients using Excelodent? Do you have any before or after Panorex to show? Unfortunately, I don't have any Panorexes loaded currently on this slideshow to show you. I can't add them in at this point, but no, I have not experienced any serious root resorption, and there has been no research that has shown that that is a risk. There are no contraindications at this point in time to using Excelodent. And so I can't see any reason why that would be an issue. What will happen if the patients use it more than 20 minutes? I'm not sure exactly. I know in the research that's been done to date, 20 minutes was found to be the correct amount of time. We tell our patients, because many of them have asked if they can use it more because their teeth feel better after they use it, we've let them know that it will not increase treatment time in any fashion, and I discourage them from doing that. I don't think there's anything showing that that would make it any better. 20 minutes seems to be the right amount of time, and so that's what we recommend to all of our patients. Fixed cases with Excelodent. How often do patients return for adjustments? Does that differ if patients use elastics? Currently, all of my fixed cases come in every 6 weeks. And that doesn't currently differ if they use elastics. For a while, we were at an 8 to 10 week interval, and I found that that was too far apart. I wanted to change wires sooner because everything was happening a little bit faster. And so we've put all of our fixed patients on a 6-week recall, unless it doesn't fit in our schedule for some reason. But that seems to work really, really well for us. Have you seen an increase in patient referrals from providing Excelodent? I would say absolutely. I don't have any specific stats on it, but the sentence that comes out of people's mouths often is, I want that vibraty thingy because so-and-so has it and they say it's awesome. There's a lot of good laughter happening in the office about oral vibrators these days. So usually people talk about it as a vibrator or the shaky thingy or the thing they stick in their mouth. And so people talk about it. I know that in Calgary, not everyone in the city offers it. I don't know of anyone who uses it routinely on every patient. And so we do speak to that when patients come in for new patient exams and let them know that it is something that is special. And so they do speak about it. So people do come in specifically asking for it. Now, for those who don't, we still talk about it. And more often than not, we get the, wow, that's so cool. Why doesn't everyone use that? And I think that on its own also lends itself to conversation when speaking to their friends about their treatment. Do you see a similar response to accelerated treatment between adults and adolescents? I think so. I find that in my fixed cases specifically, so I have about 30% adult treatment in my practice, and 80% of my adults are in Invisalign, 20% are in fixed. But in the 20% that are in fixed, I find that they are, in my limited opinion, they are getting the best benefit of that Excelodent because everything's happening faster. There are movements, especially like I said, that initial level in a line that I struggle with sometimes in deep bite adult patients. The Excelodent seems to help a lot there. Now, the slight difference in Invisalign sometimes is in that difference between switching every 5 days or 7 days. Some of my older adults, I have adults up into their late 60s in Invisalign, really feel like they can't do the 5 days. They need the 7. And I think that can just be genetic, particular individual to individual. But it seems like the younger you are, the easier it is to do that 5-day switch. My teens before Excelodent were at a 10-day switch for Invisalign. I wasn't doing 14 days. And so it easily translated that they would be on a 5-day schedule when we switched to using the Excelodent on every single person. Do you notice refinements are needed more after patients use a certain class of elastic? If so, is there any way to troubleshoot that? How do you present the possibility of a case refinement to a patient? Okay, let's go to the beginning part of that here. I don't think a certain class of elastic lends itself to more refinements. I think certain types of elastics will cause different side effects. And so in Invisalign, you have to know how to correct for that when you're doing the planning. I am not an Invisalign expert, and I think plastic is tricky. It takes some getting used to, and my treatment planning in Invisalign keeps getting better and better, so I'm slowly learning where I need to overcorrect and where I need to compensate for some of the stuff that tends to happen with Invisalign. But I find with elastics, I just have to be really careful about how often I'm having patients wear them. We usually start out at full-time wear, but with the Excellident, I find I'm dropping them to what I call half-time or 12-hour a day wear very quickly because things are moving so fast. When I present the possibility of a refinement to a patient, I don't present it as a possibility. I present it as a for sure. I simply tell them that when going into a computer to plan where their teeth are going to end up, I go in, do the best case scenario. I put all the teeth where I think they should be, and then aligners are manufactured into that ideal occlusion. However, teeth are a biological object, and everyone's body will respond to forces differently. And when we get to the end of that first set of aligners, it will not be as perfect as I want it to be. And I say it that way, it will not be perfect. And the refinement that we do after that is to get all of the small movements that did not occur with the first set, because at that point we know what happened well, what didn't happen, and we change the plan slightly. I usually explain to them that it's similar in fixed, we just do it differently. When we're in braces, we adapt to things that are not happening the way we want them to when we see it. So right away at each adjustment appointment. And we alter things chair side to compensate for whatever needs to be done differently. In Invisalign, because we're following a program through from beginning to end, it is difficult to change course, for example, for one tooth midway through if we don't have to. And so we wait till the end and then we fix up anything that didn't go the way that it was supposed to. In initial consult, I do mention it briefly, but I talk about it again at that insert appointment so that they know when they leave with their box of aligners that that is not the only aligners they will ever have. Now, sometimes it is. We're getting pretty good at that these days. But they think it's not. They think there's more coming. And as long as they know that, then no one's upset when we have to take another scan. We use iTero to get more aligners because they knew it was coming when we got to the end. And if we don't need a refinement, everyone does a little happy dance and we have a little party, which is great. So I always would rather surprise them with the fact that there's actually less treatment needed than they thought than going the other way around. Here's a good question. If you are basing your fees on treatment time and Excellident decreases treatment time, then have your average fees decreased? No. What I actually did, and in order to keep everyone, including my office manager, happy, was we took the fee structure we had for non-Excellident treatment and we kept those fees even though treatment times came down by, I would say, about 6 months was our guesstimate. And so my 18 to 24 month fee became my 12 to 18 is the same fee as what now my 12 to 18 month fee is. So it just, the timeline shifted, but the fees were all the same. So the fee is the same as it would have been did I not have an Excellident, even though the amount of time is less, if that makes sense. So I still have a range of fees based on time in treatment, but my fees stayed the same. So the range and numbers that people would hear coming into my office each day is still the same, but their amount of time in treatment has gone down. Now, depending on competition level in your neighborhood, I guess, there are lots of ways to structure this. I am one of the least expensive orthodontists in the south part of Calgary where I am. And so there's some room here that I can still go higher and not be blowing everyone else out of the water. A few orthodontists near me are very comparable. So it made sense just to leave it where it was for now while I was trying to sort out the details. But so far that's worked really well for us. This is a good one. You mentioned that you like the system for poor oral hygiene. White spot patients, etc. Are those not the same ones who are unlikely to comply with the device? Yes, they are. So this is where using discretion and having a solid conversation with patient and parents is important. We have a solid group of patients who see their hygienist every 3 months while in treatment because of previous poor oral hygiene. So it's been our way of dealing with that. And the conversation with the parents was often that we know we're going to struggle to get through this without further caries. Using the Excelident is going to make it faster. If they are unwilling to comply with brushing, they're also not going to comply with Excelident, which means I debond them anyway. So if white spots are a concern of the parents, they're usually the ones who bring this up. I have yet to say to a patient, you have white spot lesions forming, I need you to use an Excelident, because I feel like at that point, we're going to debond anyway. And I do debond for hygiene. I am very aggressive on that, and I'm not shy to say, you're done. But there have been lots of parents who have been concerned. They've had a previous child who's had white spots or know of children who've had white spots. And so we use the Excelident for those parents and children to say, look, if we get this device in, we're way less likely to have white spots because we're going to finish faster. So it's usually to address that concern specifically. I saw you give your patients all the aligners at one visit. Do they ever lose them? Only one patient ever. We had just given her 55 aligners, and she called me 3 days later and said she couldn't find any of them. I have no idea how that happens. So fortunately, with the current Invisalign setup, you're sort of unlimited aligners for 5 years with each patient. So we basically just ordered them all again, and it didn't, we just said it was a mid-course correction or whatever, and didn't charge the patient anything. But no, that has not been a concern. Yes, occasionally one aligner here or there might go missing, but usually I'll have them jump ahead, or we'll order a replacement if we need to. Are your case fees divided over a certain period of time, for example, 24 months? If so, if treatment is finished early, do you have trouble collecting the rest of the fee? Our case fees are completely separated from treatment time. So patients are given a fee, and then a discussion happens about financing to make it affordable for them. Our longest interest-free financing is 36 months. And again, it is unrelated to amount of time in treatment. And no, I have absolutely no problems collecting fees. The patients who we have trouble collecting fees on are the ones who don't pay in the first 3 months in treatment, because if they don't pay at the beginning, they're never going to pay. For patients who have an extended treatment plan, it's gone over in great detail that the payment plan is simply there to help them afford treatment, and it is no way tied to length of time in treatment. This could change at any point, I'm sure, but in the amount of time that I've been practicing, fee collection has never been an issue. So that we separated that years ago so that they are not tied together. And I think most people intend on paying their bills, and they do. We do not take a large down payment on everyone. Patients have the option of a down payment or an option of equal payments. A large number of my patients right now in our current economic climate have 36 months of equal payments as their payment. And I don't anticipate any trouble in collecting those fees. It looks like we've got 10 seconds left here, folks, so I'm not going to do any more questions, but thank you so much for your attention. Thank you for taking the time to spend an hour on your computers with me. I hope I gave you some tidbits that are helpful moving forward.